County is getting closer to developing a plan to address mental health services for the community and for inmates in the county jail. New tonight, 6 News' Marlo Lundak spoke with Douglas County Corrections about the crisis they're facing and how a new mental health facility will help.
Of the nearly 1,100 inmates in the Douglas County Jail,
recently around 40% or more of our population is diagnosed with a mental illness, and about half of those, around 20%, are typically diagnosed with a serious mental illness such as schizophrenia or another psychotic disorder.
Corrections Director Michael Myers says working with this population, especially in the current building, isn't easy.
We don't have any facilities that were built intentionally for housing and treating individuals with mental illness.
That's one of the reasons why the Douglas County Board is using $55 million in American Rescue Plan Act funding to build a new mental health facility. Right now, the community's mental health services are provided on just one floor at the county's health center.
We keep continuing to see the increase in need and rise in numbers of folks that we are serving in both of those areas.
County Commissioner Marianne Borgeson says a new facility would allow the community mental health center and the correctional facility to better work hand in hand.
They do programming and services together already, and we were thinking that if we could really combine them, build them closer, have them more close in proximity, we would even be able to do more collaboration with each other.
The county is currently considering two options. The first is building a single facility, one that accommodates inmates and community members near the jail's campus. The second option is building two separate facilities, one being connected to the jail for the inmate population, the second being the community facility, which could be built here where the current Trailways bus system sits.
With a facility designed specifically to do this, we can do much better.
Myers says no matter which option they choose, it will make a huge difference.
First and foremost, it will enable us to treat and care for the individuals in our custody who have those illnesses more effectively and more therapeutically. But it will also take a tremendous amount of stress off of our existing facility and our staff who kind of have to pigeonhole treatment into a facility that wasn't built for it.
On your site in Omaha, Marlo Lundak, 6 News.